The second round of talks going real quick with the summary. I want to try to summarize for you some of the health disparities and national trends in adolescent substance use, to examine how they impact SUD-related emergency room and treatment admissions, and to break out how adolescent trends have been impacted by the larger epidemic of opioid use. So if I look at the substances, you can see here that what we talked about before. If I look at all ages, you can see that alcohol is the dominant drug. And opioid use has been rising, particularly in the last, to levels not really seen since the late 70s. But if I look at it by age, by the substance, I see a very different pattern. For young adults, have the highest and are most likely to be related to alcohol. I look at adolescents, teenagers, they're more likely to be using marijuana than alcohol. They have alcohol, marijuana-related cannabis use disorders. You can see that this is the slide I was showing you earlier, where there's just large health disparities. If I look at it by race and ethnicity, what you can see here is that blacks actually have a lower rate of substance use disorder, and that's not new. Blacks have almost always, through back about 40 years, have always had lower rates of substance use disorders than virtually any other group. It's sort of, there's an odd stereotype that somehow blacks were worse, but they aren't. They actually have low rates of substance use disorders. What you can see here on the other end is that all of the youth have high rates of unmet need, but there is quite a bit of variation across the bottom in the rates of unmet need, with American Indian and Alaska Native having the highest rate of use, the lowest rate of receiving treatment, and the highest rate of unmet need. This is part of why we need the kind of tribal programs that J-Lo is going to be talking about in just a few minutes. If I look at the trends in adolescent substance use, you can see that there are the number of adolescent substance use disorders have actually been declining since about 2012. They hit their peak in about 2010, and the rates of kids with substance use disorders have been dropping, but it continues to be that the most common across that whole time, adolescents have always been marijuana, and this is why some of the marijuana programs are so important, because that continues to be the dominant risk for kids. If I look at opioids and break them out, you do see fairly high rates. The dark bar at the very top is all opioids. The purple bar is prescription opioids, and the red bar at the very bottom is heroin. Kids are predominantly using prescription opioids. When they use them, they're taking pills, less than shooting up heroin. It's also interesting to note that heroin use actually decreased over that period of time. If I look at adolescent emergency room admissions, I get about a 24% increase from 2004 to 2011. And that is overwhelmingly being driven by prescription opioid use and the various types of opioid use, but particularly prescription. This is just adolescent admissions to emergency room admissions. If I break it out again, this is just emergency room admissions. Again, you can see it's being driven by that prescription opioid or pill use, not by heroin use. If I look at adolescent treatment admissions, even though you see there'd been a gradual rise in admissions leading up to about 2008, when the recession hit, it hit the adolescent treatment system very hard. And across the United States, most states have retrenched and cut back on their publicly funded adolescent substance abuse treatment. It's still predominantly marijuana, but you can see this rather sharp decline from 2008. Some states it took a little bit longer to hit than others, but it's pretty much happened everywhere. If I look at the opioid admissions, they've gone up, and in spite of all the language about opioids being the high priority, even the opioid admissions for adolescents have also tanked and dropped. Not necessarily because of prevalence, but just because of the cutbacks in the size of the system. So to summarize, the prevalence and pattern of substance use disorders vary by age. There are significant health disparities by age, race, ethnicity, and the rates of SUD prevalence, going to treatment and unmet need for treatment. While the rates of SUD are down, they are still primarily related to marijuana and alcohol. In spite of declining rates of substance use disorder in the community, substance-related admissions to emergency departments are up and are primarily being driven by prescription opioid use. In spite of high rates of unmet need, the number of adolescent treatment admissions in publicly funded treatment has continued to decline since 2008 recession. And with that, I will stop.